So it's my honor and pleasure to invite Dr. Thushanth Thomas sir for the wonderful topic, diabetes-specific nutrition Indian perspective. So Thushanth sir is the Chief Coordinator, Department of Endocrinology, KIMS Health Trivandrum. He was presented with the Best Paper Award at ESICon 2010 and Best Paper Award at Endocrine Week conducted by ESI in 2020. He is the Treasurer for ESICon 2017 and the present Treasurer of PACE. With this few introduction, I would like to invite Thushanth sir.
Good evening, dear friends, respected Chairperson. At the outset, let me thank the organizers for giving me this opportunity. So, my topic would be about diabetic-specific nutrition. So, it's basically about one or two studies which have been conducted in diabetes and pre-diabetes with respect to a nutrition supplement which we often use in diabetes. I will not be touching upon in broad about medical nutrition therapy in diabetes. It would be specifically about these two studies with this nutrition supplementation. So there are several data which suggest that the Indian diabetic patients are different from their Western counterparts with regards to various aspects, like we have more of diabetic patients who have earlier onset of diabetes. There is clustering of multiple cardiovascular risk factors, centripetal adiposity, dyslipidemia, hypertension, and it may be due to several interrelated factors like genetic factors, dietary factors, lifestyle choices like level of physical activity. So all these would play hand in hand, and finally we have a clustering of cardiovascular risk factors at a comparable BMI with the Western counterparts. So this is the Indian specific data, the concept of thin fat Indian. Indians have, like, they appear to be thin but have high body fat, especially the centripetal obesity, leading to higher insulin resistance and diabetes risk. So for a same person, so it's, if you compare two persons, like one Indian with a Caucasian with the same BMI, you will have more of body fat for the Indian person. That is what we call the YY paradox. You would have all seen a photograph of two doctors sitting together, one Indian, one his UK counterpart, having the same BMI, but the body fat was more for the Indian doctor as compared to the Western, the Caucasian. So Indians on an average have an earlier age of diagnosis with regards to type 2 diabetes and various markers of obesity like waist hip ratio, all were much higher in Indians as compared to the Western diabetic patients. So this is one of the studies, effect of a diabetes-specific nutrition supplement on glycemic, anthropometric, dietary and gut health markers in adults with type 2 diabetes, conducted at the Mohan's Diabetes Center. So they studied the impact of 12-week supplementation of the diabetic-specific nutrition supplement, which is the Horlicks Diabetes Plus, along with standard of care on multiple markers as compared to just standard of care alone. So around 1,300 patients were screened, and finally around 210 patients were randomized equally into both the groups. And these were the outcomes which were studied: the anthropometric markers, the glycemic markers, the gut health markers, CGM markers, other markers like lipids and blood pressure, and dietary markers. So this is the recommendation, like what we should be doing. Like most of the guidelines have recommendation in the similar way with regards to diabetes or medical nutrition therapy in diabetes. Like we have to restrict on the carbohydrate and increase in protein, increase in the fiber content of the diet, which can help in control of diabetes as well as progression to diabetes from pre-diabetes. So this is the ICMR in-type national study. Based on that, the ICMR recommendation. So in diabetes remission in newly detected diabetes, we have to restrict the carbohydrates to roughly around 50%, protein around 20, fat around 25%. Whereas in pre-diabetes and in to prevention of progression to diabetes from pre-diabetes, in all these scenarios, we require almost similar dietary recommendations. So in effect, we have to restrict the carbohydrates to roughly around 50%. But as you may recollect, most of the Indian studies, especially the famous START study, have shown that most of the Indian population, whatever be the geographic area, the carbohydrate content is more than 60%, and in some areas it's almost 60 to 70% also. So we have to basically cut down on that carbohydrate content. So we have to find out a supplement also. We cannot just tell them that you cut down on this and then they cannot keep starving also. So we have to find out a solution to this. So we can go for other option, that some supplement which can help in improving the fiber content of the diet, and which will not have a high glycemic index, so that the postprandial glucose values and overall glycemic control can be brought down. So we need to think about a specific nutrition supplement which would help in reducing the carbohydrate intake. So the dietary fiber in diabetes, it can help in improving the glucose values, can help in reducing the weight and the cholesterol levels. It can improve the gut microbiota, and most importantly, it can improve the satiety, because satiety is one thing that would reduce the food intake of the patient. So in this particular study, they supplemented the patients with this particular diabetes-specific nutrition supplement in addition to the standard of care, and that helped in bringing down the glucose values after 12 weeks. The study was for 12 weeks. It helped in bringing down the glucose values by almost 17 milligram, the fasting glucose value. So in the intervention arm, you can see that there is a reduction in glucose values, whereas in the standard of care alone group, there was an increase in the fasting glucose value as compared to the baseline. And the postprandial value also, there was not much of significant reduction in the standard of care group alone, whereas in the diabetes specific nutrition supplementation plus standard of care group, there was much better reduction, almost 35 milligram was reduction in the postprandial. So both fasting as well as postprandial glucose values were brought down significantly as compared to standard of care alone in this study, in which the diabetes specific nutrition supplement was used. And time in range also improved by 9% from baseline in this subgroup as compared to standard of care alone. And when they looked at the dietary content of the persons, there was 20% lower carbohydrate intake in 12 weeks with the Horlicks Diabetes Plus as compared to the standard of care. So what we needed was around, when we saw the previous graph, like at least 15 to 20% reduction in carbohydrate content in the diet. That is what we require. So this could achieve that. Almost 20% reduction in carbohydrate intake could be achieved at 12 weeks. And dietary fiber intake was also 38% higher at 12 weeks with this diabetic specific nutrition supplement. So gut microbiota plays a major role in glucose homeostasis. The dietary fiber, when it reaches the intestine, the gut microbiota can act on that, and it ferments it. It uses it for its energy, and it can break down it to small chain fatty acids like acetate, propionate, butyrate. And these small chain fatty acids are proposed to have multiple actions, especially with regards to improving the satiety, improving the glucose sensitivity. It has so many actions, these small chain fatty acids. So the dietary fiber can increase the small chain fatty acid production, and this can benefit the glucose homeostasis. And so this is one proposed mechanism by which it can act, the dietary fiber that we give. So these are the various small chain fatty acids which were studied: acetic acid, propionic acid, butyric acid, and all these were significantly improved or increased in concentration as compared to the standard of care alone. And these molecules, the small chain fatty acids, are involved in regulation of appetite hormones. It can reduce ghrelin and elevate the PYY. Ghrelin is a molecule which increases the hunger. So it can act on ghrelin and suppress it so that the satiety of the patient will be improved. Yeah. So the effect on weight, it could reduce the weight by around 0.6 kilogram. BMI was brought down by around 0.4. Waist circumference was also improved. LDL cholesterol levels were also significantly reduced, maybe because of the weight loss as well as the reduced direct carbohydrate intake. Those would be the most probable reasons for reduction in LDL cholesterol. There was 4% lower LDL cholesterol versus baseline after 12 weeks. So the diabetes-specific nutrition supplement with its low glycemic index, optimal blend of high fiber protein, monounsaturated fatty acids and low carbohydrates seem to initiate a beneficial cascading effect when combined with the standard of care. So whatever standard of care is there, it should be, this can be used as a supplement to that. As we saw, in the dietary intake of the patient, it led down to reduction in carbohydrates, improving the fiber content. Then in metabolic parameters, it improved fasting as well as postprandial values. There was better time in range. There was a reduction in weight, waist circumference, 4% reduction in LDL cholesterol. So overall, it improved the diabetes management with specific regards to cardiometabolic risk. There was a study in pre-diabetes also. The prevalence of pre-diabetes in India, it's pretty high in most of the populations, and we can see in Kerala also it's more than 15%. And pre-diabetes we categorize as impaired fasting glucose and impaired glucose tolerance. Many times we may not see much symptoms in the pre-diabetic state, but what is most important is that it can lead on to overt diabetes. And what are the standard risk factors for type 2 diabetes? Those are the same risk factors for pre-diabetes also: overweight, family history, dietary indiscretions, poor physical activity, past history of gestational diabetes. All these can lead on to pre-diabetes. And the cutoffs, I think we all are aware, we did not go into those. And even in pre-diabetes, we should start the medical nutrition therapy because we can arrest the progression to overt diabetes if we start intervening at the phase of pre-diabetes itself. So in that phase itself, we have to emphasize on restricting the calorie intake, improving the dietary fiber content so that the progression to diabetes can be retarded. So these are the two types of dietary fiber, the soluble fiber and the insoluble fiber. The insoluble fiber doesn't have much of any metabolic benefits. So the insoluble fiber would mainly help as a laxative. It would improve the constipation, whereas soluble fiber is the one which we discussed just now. The soluble fiber is the content which can help in producing the small chain fatty acids, which have a significant effect on the postprandial glucose control. It can improve the satiety. It can have an anti-inflammatory action. It can delay the gastric emptying. Overall, it improves the metabolic parameters. So soluble fiber is what we require. Yeah, I think we have already discussed some of the important points. Glycemic variability also. So this is the AACE guidelines for pre-diabetes. This is one of the earliest recommendations for pre-diabetes which has come up in the recent past. Otherwise, we had recommendations for diabetes alone. So what they recommend is for pre-diabetes is we have to aim at lifestyle intervention. That is the first thing that you require, and aim for weight loss. A standard of care would be like 7 to 10% of weight loss, and if you are not able to achieve desired glycemic control with that, then we can think about acting medications, and that can be medications which are used for obesity, or if the patient progresses to diabetes or is having persistent high glucose levels in the pre-diabetic range itself, there are certain medications which have been found to be beneficial, like metformin is one drug which has been used, but weight loss would be the most important thing in pre-diabetes. So just like the previous study in overt diabetes, This was another study which they conducted in pre-diabetes with the same diabetes-specific nutritional supplementation. Around 200 patients were randomized to 2 groups, and they looked at the postprandial glucose value and the incremental area under curve. These are the acute blood glucose response to parameters which they looked into. And the diabetes-specific nutrition supplement group showed significantly lower postprandial glucose values versus the isocaloric snack. The isocaloric snack used was cornflakes. So that was significantly reduced in the significant reduction in the postprandial values were there in the diabetes-specific nutrition group as compared to the isocaloric snack group. The incremental area under curve, that means how fast the glucose values were increasing, that also were reduced in this particular group as compared to the control group. So this is with regards to the Holistic Diabetes Plus. Basically, it provides soluble fiber, around 22% soluble fiber, high protein content, roughly around 23%, and monounsaturated fatty acid. So basically, it can be used as a meal supplement. It need not be a complete meal replacement. As an evening snack, you can use it. So basically, it can be used as a snack or as a partial meal replacement. So breakfast, a portion of the breakfast, you can use this along with whatever they are usually having, so that the carbohydrate intake can be brought down, and this will help in improving the satiety and the fiber content of the diet. Yeah, so with that I come to the end of my presentation. So basically it's about the importance of diabetes-specific nutrition supplement in the management of diabetes and pre-diabetes. So you can use this particular product, and it can help in improving the glycemic parameters as well as in weight reduction and a minimal reduction in cholesterol levels, and overall cardiometabolic improvement can be achieved in diabetic as well as pre-diabetic patients.
Thank you, sir. Thank you for the wonderful session. So now we will take up 1 or 2 questions from the audience.
Powder. Yeah, it's left to the person's discretion. Even one's choice, or it can be used as a snack. Instead of taking any other snack, this can be used, or as a partial meal replacement, especially for say breakfast, because many times we tend to take a very heavy breakfast. So as a partial meal replacement for the breakfast, it can be used. So I think it would cost around 400 grams. With regards to the gut microbiota, that's what you are mentioning. Yeah, because it also has an action on the gut microbiota. Yeah, curd also can be, curd or yogurt, both can be used. I actually recommend to most of the patients, like those who are afraid to, or they are not very comfortable with milk, many times we advise curd to them, because that also is very much beneficial. It provides similar benefits.
What's the preferred fiber
So I think soluble fiber all would have similar effect. So basically the insoluble fiber would not have much benefit on the cardiometabolic parameters, would have more effect on the gut bowel movements as such. So this particular product contains fiber sole. So they are basically low calorie, because most of the other things it has calorie also, like what if you take it you will get calories. So this is a low calorie molecule which is present, the fiber which is present in this particular product.
So whole grain cereals, fruits like apple, it has got soluble fiber.
Natural fiber, natural source.
Natural.
Yeah, that I think in most of the whole grains you get it, like when you use it. not the fully refined form when you use it in the normal form.
Plant protein in diapers.
Protein.
Plant versus
I think both, we can use both. I think there is no,
So in the case of animal protein, we need to choose lean proteins, that's all, to remove the fat and all, no? Otherwise, protein is very important. If you are looking into the non-vegetarian protein, you should look for the lean proteins, that's all. I think we can wind up the session.
Thank you.
Thank you once again, sir, for the wonderful session. Thank you.